So there are risk factors for breast cancer, for developing breast cancer, but the fact that you have a risk factor doesn't mean by all means you get breast cancer. It just means that there is some increased chance of getting breast cancer. The commonest risk factor really is being a female. Once you are born a woman, you are at risk of getting breast cancer. And then as we are aging, the body, undergoes some wear and tear. The older you get, the higher your chance of getting breast cancer. Other risk factors may have to do with your reproductive health or reproductive issues. So we know that when a woman is exposed to very long years of the female hormones, that is our menstrual cycle, it can increase our risk of getting breast cancer. So starting your menses at a very early age, let's say 9 for instance, and menstruating all the way through to maybe 55 years or more. So that's a long period of being exposed to the menstrual cycle, because these hormones have something to do with the changes in our breast. And then if you happen to have a very close relative with breast cancer, that could also increase your chance of getting breast cancer. Most people actually don't have it in the family, but about 10% of people will have a close relative who's had breast cancer before, or perhaps even some other types of cancers. All these things I've mentioned, you can't do much about it, but there are some modifiable risk factors. For instance, a healthy diet. So we know that those who eat more fruits and vegetables, less alcohol, none if possible, and then get some exercise, all that helps. Another protective factor is breastfeeding. So if we are able to breastfeed our babies for as long as possible, even up to 2 years, that would be great. It does reduce your risk of getting breast cancer. So definitely let's increase breastfeeding, which of course has other benefits. The best way to diagnose breast cancer actually is through screening. You don't really need to wait till you get any symptoms. Ideally, you should check your own breast, do a breast self-examination every month. Every year you can visit the hospital, get a nurse or a doctor to examine your breast. And it's very important that by the age of 40, you should start doing your mammograms. Every 1 or 2 years, you want to do a mammogram. So that's the best way to detect breast cancer. Having said that, you might notice a change in your breast. The commonest, of course, is a breast lump, but there could be other signs and symptoms of breast cancer. For instance, bloody nipple discharge. I know a lot of women have nipple discharge, it's white, it's cream, but really that's not an issue. Unless it's the discharge is copious and quite abnormal. But when it's bloody, that's a red flag. It may not always be breast cancer, but there's that risk there. The breast may swell up. You may see some skin changes. The nipple may even have a small sore or a rash on it. That could be a sign of breast cancer.